This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is the mode of inheritance for X-linked recessive? Answer: X-linked recessive is a mode of inheritance where the gene for a certain trait or disorder is located on the X chromosome. Question: what is the chance of a son of a heterozygous mother being affected by an X-linked recessive disorder? Answer: the chance of a son of a heterozygous mother being affected by an X-linked recessive disorder is 50%. Question: is there male-to-male transmission for X-linked recessive disorders? Answer: no, there is no male-to-male transmission for X-linked recessive disorders. Question: does X-linked recessive inheritance skip generations? Answer: yes, X-linked recessive inheritance can skip generations. Question: are X-linked recessive disorders commonly more severe in males? Answer: yes, X-linked recessive disorders are commonly more severe in males. Question: must females be homozygous to be affected by X-linked recessive disorders? Answer: females usually must be homozygous to be affected by X-linked recessive disorders. Question: what is the inheritance pattern of X-linked recessive disorders? Answer: X-linked recessive disorders are inherited in a pattern where a mother who is a carrier of the disorder can pass it on to her sons, but not her daughters. Sons have a 50% chance of inheriting the disorder, while daughters have a 50% chance of becoming carriers. Question: how does the inheritance of X-linked recessive disorders differ between males and females? Answer: in males, X-linked recessive disorders are usually more severe as they only have one X chromosome, and if it carries the disorder, they will be affected. In females, they have two X chromosomes, and so they would need to inherit the disorder from both parents in order to be affected. Question: are X-linked recessive disorders more prevalent in males or females? Answer: X-linked recessive disorders are more prevalent in males as they only have one X chromosome, and if it carries the disorder, they will be affected. Question: how does X-linked recessive inheritance affect multiple generations of a family? Answer: X-linked recessive inheritance can skip generations as carriers do not show symptoms of the disorder but can pass it on to their sons. It can also affect multiple generations of a family as the disorder can be passed down through carrier mothers. Question: how do X-linked recessive disorders differ from other types of genetic inheritance patterns? Answer: X-linked recessive disorders differ from other types of genetic inheritance patterns in that they are caused by a gene located on the X chromosome and are inherited in a pattern where a mother who is a carrier of the disorder can pass it on to her sons, but not her daughters. Other types of genetic inheritance patterns include autosomal dominant and autosomal recessive. Question: can X-linked recessive disorders be inherited from fathers? Answer: no, X-linked recessive disorders cannot be inherited from fathers as the gene for the disorder is located on the X chromosome, and fathers only pass down their Y chromosome to their sons. Question: are there any common examples of X-linked recessive disorders? Answer: yes, there are several examples of X-linked recessive disorders such as hemophilia, Duchenne muscular dystrophy, and Fabry disease. Question: what are the chances of a daughter inheriting an X-linked recessive disorder from her mother? Answer: the chances of a daughter inheriting an X-linked recessive disorder from her mother is 50%. Daughters inherit one X chromosome from their mother and one from their father. If the mother is a carrier of the disorder, she has a 50% chance of passing the affected X chromosome to her daughter. Question: are females who inherit an X-linked recessive disorder usually symptomatic? Answer: females who inherit an X-linked recessive disorder are usually only symptomatic if they are homozygous for the disorder, meaning they have inherited the disorder from both parents. If they inherit the disorder from only one parent, they are usually asymptomatic carriers. Question: how can X-linked recessive disorders be treated? Answer: the treatment for X-linked recessive disorders depends on the specific disorder. Some can be treated with medication or therapy, others may require surgery or other interventions. Genetic counseling and prenatal testing can also be helpful for families who may be affected by an X-linked recessive disorder.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.